Hey guys, this is Dr. Gonzalez. What's up? It's been a while since I've shown my face in one of my videos, so I'm trying to listen more to what the students are asking for, and so here we go. Today we're going to talk about the following topics, and let's go ahead and talk about the back. Okay, on this video we're going to go over the deep back muscles and additional muscles as well as additional structures. But first we're going to start here with a structure called the thoracolumbar fascia, which is a fascia that encloses the deep back muscles in the thoracic and lumbar regions. It is a very strong and thick in the lumbar region, and it's a little bit thinner in the thoracic region. In the lumbar region, this structure is divided into 3 layers. There's going to be a posterior layer that attaches to the spinous processes. There's going to be an intermediate layer that attaches to the transverse processes. And there's going to be an anterior layer that forms the quadratus lumborum fascia, and it attaches to the transverse processes. Regarding the deep back muscles, these are going to be innervated by the dorsal rami of spinal nerves, and these muscles are going to be divided into 3 layers. First, we got the superficial layer, which consists of the spinotransversalis muscles, such as the splenius capitis and splenius cervicis. We also have an intermediate layer, which it's formed mainly by the erector spinae muscle. And then there's a deep layer that it's formed by the transversospinalis muscles, and these fibers are going to run superiorly and medially. So here we got the splenius capitis. The origin of this muscle, it's the ligamentum nuca, and the spinous processes of C7 to T3. The insertion of this muscle, it's going to be into the lateral part of the superior nuchal line and the mastoid process. The other splenius is called the splenius cervicis, and it's this muscle right here. The origin of this muscle is going to be the spinous processes of T3 to T6. So this is, for example, a few of those vertebrae. And the insertion is into the transverse processes of the upper 3 or 4 cervical vertebrae. The nerve supply is going to be the dorsal rami of the cervical spinal nerves. Actually, this nerve supplies both muscles, the splenius capitis and splenius cervicis. And the action of both muscles, splenius capitis and splenius cervicis, is for the extension of the head and the neck, and the lateral flexion and rotation of the head and the neck to the same side of the contracting muscle. In this part of the video, you can observe how the splenius are actually moving the head as in lateral flexion. In the medial layer, we're going to find the erector spinae. This muscle has an origin basically from the posterior part of the iliac crest, the posterior surface of the sacrum, and the spinous processes of the lower 2 thoracic and all the lumbar vertebrae. So this is a very large muscular mass, and it's divided into 3 columns. We have an iliocostalis, which is the most lateral side or division. We have the longissimus, which is the largest component of this muscle, and it's the intermediate column. And then we have the spinalis, which is the smallest component of the erector spinae, and it's on the medial side. Now, each column has regional divisions. And for example, the iliocostalis, it's going to have an iliocostalis that we call lumborum, thoracis, and cervicis, right? Lumborum means it's more lower on the lumbar area, thoracis on the thoracic area, cervicis closer to the neck. Longissimus has a thoracis, cervicis, and capitis, right? Thoracis on the area of the thorax, cervicis closer to the neck, and capitis is going to be closer here to the head. And then the spinalis also has a similar division, thoracis, cervicis, and capitis. As for the deepest layers, we have a group of muscles that we call the Transversospinalis. This muscle basically runs superiorly and medially from the transverse processes to the spinous processes. And depending on the length of these muscle fibers, this is going to be divided into three components. So for example, we have the semispinalis, which is a muscle that spans 6 vertebrae between origin and insertion. The multifidus, which fibers span from 3 to 5 vertebrae between the origin and insertion. And the rotatories, which are it's a muscle fiber that span between 1 or 2 vertebrae between the origin and the insertion. Now these transversospinalis essentially have a nerve supply. Specifically, it's going to be the dorsal rami of the spinal nerves, and the action is going to be, for example, the extension of the spine, lateral flexion, rotation of the spine, and they also function to stabilize the vertebral column. Let's go over the semispinalis first. The semispinalis, it's present from the lower thoracic spine to the skull, and it has 3 parts. It has a thoracic part, or semispinalis thoracis, semispinalis cervicis, and semispinalis capitis. So specifically, the semispinalis capitis is going to be the largest muscle mass on the back of the neck, as you can observe right here. And this muscle in general originates from the transverse processes of C7 to T6, or T7 vertebrae and the articular processes of C4 to C6. And then this muscle, it's going to insert basically into the occipital bone here, in the medial part of the area between the superior and inferior nuchal lines. The other muscle that we talked about earlier is the multifidus, and this is basically present along the whole length of the spine, as you can observe right here. In the sacral and lumbar regions, this muscle is going to lie deep to the erector spinae, and then in the thoracic and cervical regions, this muscle is going to lie deep to the semispinalis, and the fibers are going to insert into the spinous processes of all the vertebrae from the L5 to the axis. And then there was the rotatories. These muscles are going to be the deepest muscles, as you can see right here, and they are located in the groove between the spinous processes and the transverse processes. These muscles are going to be best developed in the thoracic region, as you can observe right here, and they extend from transverse processes to the spinous processes of the vertebra located immediately above, or to the spinous processes of the second vertebra above. Now let's go over some of the other muscles that are associated with the spine. So here we're going to get started with the intertransversary muscles. These are muscles that are extending between the adjacent transverse processes of these vertebrae. And as you can see, they are developed mostly in the cervical and lumbar regions. So here we show them on the cervical region and on the lumbar region. And the action of these muscles is to act on a lateral flexion of the spine and the stabilization of the adjacent vertebrae. Now the other group of muscle is the interspinalis. These muscles extend between adjacent spinous processes. They are very developed in the cervical and lumbar regions also, as you can see right here. And the action of these muscles is the extension of the spine and the stabilization of the adjacent vertebrae. Now we also have other muscles that are part of a group we call the suboccipital muscles. These are 4 very short muscles located between the occipital bone and axis, and these are the deepest muscles in the upper part of the posterior neck. So the components are going to be 4. We have the rectus capitis posterior major, rectus capitis posterior minor, obliquus capitis inferior and obliquus capitis superior. In this picture right here, we're looking at the rectus capitis posterior major, and this muscle has an origin in the spinous processes of axis or C2, and the insertion is the lateral part of the inferior nuchal line. As I said before, the nerve supply is the suboccipital nerve, and the action of that muscle is the extension of the head and the rotation of the head to the same side. Now we also have a rectus capitis posterior minor, and this one is located medial and partly under the rectus capitis posterior major. The origin of that muscle is going to be the posterior tubercle of atlas or C1. The insertion is going to be the medial part of the inferior nuchal line, and the action is the extension of the head. As for the obliquus capitis, we have an obliquus capitis inferior. This one is going to be inferiorly to the rectus capitis posterior major. And so that muscle, the origin is the spinous processes of axis or C2. The insertion passes superiorly and laterally to insert into transverse processes of atlas or C1. The nerve supply, like I said before, still the same, a suboccipital nerve, and the action is the rotation of the head to the same side. And we also have an obliquus capitis superior. The origin of this one is the transverse processes of atlas or C1, and the insertion is the lateral part of the area between the superior and inferior nuchal lines. And the action is the extension of the head, lateral flexion of the head to the same side of the contracting muscle. So as you can see right here, these muscles are going to form sort of like a triangle shape that we call the suboccipital triangle or SOT. So the boundaries for the SOT is going to be medially the rectus capitis posterior major, laterally it's going to be the obliquus capitis superior, inferiorly it's going to be the obliquus capitis inferior, and these is going to be covered by the semispinalis capitis, which is what we call the roof, and the floor, it's going to be the posterior arch of the atlas and the posterior atlanto-occipital membrane. And so the contents within this triangle, it's going to be the vertebral artery and the suboccipital nerve. In the same area, there's going to be a nerve called the greater occipital nerve, which is labeled here in purple. So this is coming from the dorsal radius of C2 spinal nerve. It curves around the inferior border of the obliquus capitis inferior and ascends over the suboccipital triangle. It pierces the semispinalis capitis and the trapezius to reach the area of the scalp. And it divides into branches that will supply the skin of the posterior part of your scalp. And if you like this video, here's another suggestion that you can watch. It's in the corner. And that's it for today. Thank you for watching this video, and I'll see you in the next one. Bye.